Welcome to Adapt and Class, home of content simplicity. Today, I have 10 physiological adaptation questions. These are high yield, commonly tested, designed for anybody taking NCLEX or any nursing school exams, either ATI or HESI exams. These are commonly tested. They are classic physiological adaptation. Are you ready? Let's get it done. First question, as you can see, straightforward but tricky, because that's the purpose of physiological adaptation, to see if you can identify a patient who is in trouble. How do you approach this question? Started from the back. Which action should the nurse take first? An action I need to take first. Circle that idea that you got to do something first. What is the issue? A nurse is caring for a client who is what? 24-hour post-operatively following what? Pelvic surgery. The client suddenly become what? Cyanotic, gasping for what? Breathing, and report what? Chest right side, and report of what? Right-sided chest pain. Which action should the nurse take first? Call the rapid response team, administer oxygen via face mask, assess the surgical incision for bleeding, notify the air care provider immediately. How do you answer question? This is the way I approach the question. I go for the buzzwords. I see first is key, right? Then I look at the rest of the answer choices. And the question is, a nurse is caring for a client 24 hours after surgery. All of a sudden has what? Sudden onset of what? Cyanotic. Patient is getting blue, gasping for air, and then at right-sided chest pain. What do you think is going on? Those information connects the dots, and I know that a post-op patient, what has happened to the patient? Does the patient have any condition that is making them look blue, having shortness of breath and chest pain? You have to make a diagnosis. What do you think? Put down your answer in the comment, your diagnosis for this patient, before we look at the answer choice itself. But if you look at it carefully, connect the dot. After surgery, you have shortness of breath, gasping for air, and you have chest pain on the right side. This is most consistent with pulmonary embolism, not MI, not myocardial infarction. Therefore, do I call a rapid response? Do I give the patient oxygen? Do I check surgical site incision for bleeding? Or do I notify the air care provider? These are things I want you to pay attention to carefully. What will be your answer choice? Which one will you pick? Think about it. Break down the question. Break down the question and put your answer in the comment. If you are in this situation, what would you do? What would you do? Let's look at its answer choice. Rapid response. Patient is not doing well. This may be right. Give the patient oxygen. It's also okay. I can give the patient oxygen. Assess the incision for what? Bleeding. You know this is not the bleeding issue, so this is eliminated. Notify the air care provider. Yes, of course, we're going to let the doctor know. Can I do something before the doctor is aware? That means this is wrong. Then you left with this. Which answer choice you pick? The right answer is number one. Why? Watch this. This is the mnemonic I want you to take with you. If you're doing prioritization and you see the patient is crashing and is unstable, you need some help. But if the patient is stable and is deteriorating, you can do something first. Once again, if the patient is unstable and crashing, dying in front of you, what you do? Call rapid response. If the patient is stable but deteriorating, that means going down, you got to do something first. Therefore, in this situation, client is dying. He's turning blue, he's looking for air, and then what? Right-sided chest pain. We'll rather call for help and help with the situation, and then we can give them oxygen. Oxygen is not going to solve this problem. We need help as much as possible. This patient is dying. So number one is the right answer. Same strategy. Which of the following actions should the nurse take? To give you a concept, which of the following actions should the nurse take? It's a selected apply. You don't have to pick everything. A nurse is caring for a client with what? Diabetes insipidus. That's your buzzword. You're going to underline that buzzword and you said, this is my buzzword. What would you do? I give the patient what? IV infusion of 3%. I give the patient vasopressin. I restrict fluid. I give the patient canivactin and then monitor the electrolyte. Physiological adaptation, endocrine play a role. Cardiac issue play a role. Renal play a role. This is the way they ask you the question. I did a video recently, yesterday. It's a supplement to this. Watch it, know the content area, and see the way the question is mostly prioritization and what you know about content. Now, DI, what is diabetes insipidus? You know what it is. The patient is lacking ADH. If you're lacking ADH, you're going to lose all your water, right? And therefore, if this is your blood, there's not going to be water there. Your blood will be what? Concentrated. If your blood is concentrated, sodium is going to go high, right? Your osmolarity is going to go high. Your urine sodium is going to go low, and the urine get diluted. In the process, you're going to get dehydrated. So this patient is dehydrated. What would you do? I've given you the content. Put your answers in the comment. Number 2 is a select or apply. You don't have to pick everything, but let's break down the question and the answer choice. What do you think? Patient sodium is going to be high. Why would you give them 3%? Not indicated. Patient need vasopressin. We're going to give them vasopressin because they don't have ADH. Why would you restrict fluid? The patient is dehydrated. We should give them fluid. Therefore, this is wrong. Administer canivactin. These block ADH. Patient need ADH. Therefore, this is wrong. Monitor serum electrolyte. Of course, they are having electrolyte issue. We should monitor them. Therefore, if you pick 2 and 5, you are right. And thank you for watching Adapting Class. This is the concept I want you to pay attention to. DI, you have dry inside. Therefore, your urine increases, urine output, your sodium goes up in your serum, and you have low ADH. You give them vasopressin, and then you encourage fluid. Remember, the fluid you're going to give them is based on your sodium, mostly hypotonic solution, not hypertonic solution. So watch for that. Which of the following findings should the nurse expect during the emergent phase of burn injury? This is a classic NCLEX question based on content. A lot of people can mix this question, so I want you to write it down and pay attention to the concept. A nurse is assessing a client who sustained what? 45% total body surface area. This is the trap. I just put it over there. Patient has a burn wound. If you don't know what the 45 means, it means they burn. Body is burned. I'm asking you for more. Emergent phase. You have to know the 3 phases of the burn injury, right? Emergent phase, what does it classify? What does it classify? What do you expect? You expect U wave, you expect bradycardia, a PT wave, and a diarrhea. Go with your content and ask yourself, what would you see if the patient burned? And at which phase? I'm asking you about emergency phase. Stop the video, think about it, try to come up with the answer and see what is going on. And then you use the content to answer the question. Which answer choice you pick? I know you picked the right one because you watch Adapting Class. But let's look at it. This is the burn wound. When you burn yourself, your cells break down and they release their content. Potassium goes high. You lose all your fluid. Therefore, your sodium goes down. It goes into interstitial fluid. That's why they have edema. And all the fluid that they lose, they become hypotensive. So this is early phase. Early phase is emergent phase. So in emergency phase, you have what? Hyperkalemia, hyponatremia, and dehydration. Therefore, what are you going to see? U wave is associated with what? Hypokalemia. Bradycardia, you dehydrated, you're going to be what? Tachycardic. PT wave is associated with what? Hyperkalemia. Diarrhea, your sympathetic nervous system is all up. Therefore, when you have a burn wound, your sympathetic nervous system is up. Therefore, you're going to have what? Decreased GI activity. You're not going to have diarrhea. You're going to have distension. Therefore, this will have paralytic ileus. They're not going to have bowel movement. Which answer choice do you think it is? PT wave. That's the key. So this is the mnemonic. This is the key concept in the simple, straightforward way. This is all you need for burn injury, right? Burn, cells burst, potassium out. Early phase, you have hyperkalemia. You see peak T wave. Later phase, now you get all the fluid. You dilute this potassium, and you have U wave. Concept mastering. Number 3. What is your score? I would like to know in the comment section, and let me know what you think. And then in the emergency department is caring for a client diagnosed with acute epiglottitis. This is one of the questions that can trip you. This is one of the questions that always trick people, because the answer choice, all of them are right. You can think about it that this is what I think I would do. But in this situation, don't do that. Keyword is what? Epiglottitis. Whenever you hear epiglottitis, think about it. Emergency. Alarm bell should go up. And that is physiological adaptation. Is emergency situation. This is what you need for your ATI, HESI, or NCLEX exams. This is what they ask you. First, right? Emergency is an airway. What would you do? Examine their mouth with the tongue depressor. Place the patient in autopnic position, give them epinephrine, racemic, place oxygen via nasal cannula. There's a bunch of things there. 1 said, examine the patient, look into their mouth. 2 said, place them in autopnic position. And 3 said, well, give them racemic epinephrine. And 4 said, give them oxygen. Epiglottitis patient is an emergency. What do you think? I would like to know. In the comment section, just say, I got this question right. But this is the key. You should never look into their mouth, no matter what. Therefore, this is gone. The throat there and the tongue depressor is a trap. Never look. A top-neck position, you may not know, but this is the same thing as what? Tripod position. What do you think? They can change the word. Racemic epi can help, but it can make the kid tachycardic. You don't want them to have tachycardia. At the same time, you better not give them medication if you know there's an airway issue, if you can do something first before medication. Oxygen via nasal cannula, fine. You can give them oxygen. Nasal cannula may irritate them, but it's still getting oxygen. You rather give them face masks. But what is the key? This is what I want you to write down. The top neck is the same thing as tripod position. And therefore, this is the key. You do not poke the inflamed throat. If the throat is inflamed, don't look at it. Don't poke it. If you poke it, you're going to die. If you poke it, you're going to get into trouble. Therefore, never examine their mouth and keep them upright as much as possible. The other information is this. Tripod position saves life. It's first before you oxygen. Position before you give them oxygen, and then second medication. So always in this situation, tripod position before you give them oxygen. Which action should the nurse perform first? Same thing first. The client on a mechanical ventilator triggers a high pressure alarm. Before you even look at the answer choice, spend some few time, 5 seconds, break down the question. What is being asked? He said first, about what? Mechanical ventilator, what has happened to it? I trigger high pressure alarm. Therefore, my buzzword is what? High pressure alarm, ventilator, and first. Connected. That means if I have a ventilator having high pressure alarm, what would I do? Then bring your content. You say high pressure alarm, there's a blockage. Therefore, I'm looking for answer choice that talk about blockage. You say what? Check for kink in the endotracheal tube. It looked like blockage. What? Silence the alarm and notify the air care and notify the respiratory therapy. It has nothing to do with blockage. Assess, even when you silence it, you're losing the opportunity to know that something is wrong. Assess for endotracheal tube leakage. It doesn't mean blockage. Assess for need for suction. It means blockage. So you have two things that talk about blockage. What answer choice would you pick? This is where patient care comes in. Do you want to deal with the tube, a machine, or fake patient? I can tell you, I'd rather deal with the patient. The most common cause of blockage is mucus. You better check and see they don't have mucus plug before you look at the endotracheal tube. Therefore, I say prioritize the patient over the machine. See the patient first. Make sure it doesn't need suction before you look at the machine. So that's the most important. We are midway. Which action should the nurse take? This is also test-taking strategy, but being able to identify physiological adaptation to prevent further, to know that something bad is going to happen. That's all the question is. It's like a form of prioritization, but you're anticipating that something may go wrong. So you want to intervene before, right? Then it leads to risk reduction. But this is physiological, identifying deteriorating changes. Which action should that take first? The client is recovering from what? Stroke. You begin coughing and choking while drinking water, right? Key. The nurse notice what? The gargling voice quality afterward. After that happened, this is what is the nurse noted. Will you reposition the client and attempt to swallow again? Notify the speech language pathologist. Place the client on what? Nothing by mouth and suction the client airway. Think about it. I always say question answering requires some strategy. Don't rush. Step back. Go to the question back. Let's read it from the back again. First thing I got to do, what happened? Patient had stroke. And what did they do? They're coughing, choking after drinking water. Now, this is what I'm seeing now. So whatever is happening, I don't care about it. I care about gargling voice quality afterward. That means something is not right. Would you reposition them and attempt them to do that again? No. They're having problem. Patient probably is aspirating. Speech language pathology is too late. I need to fix the problem right now. Place the client NPO. That means nothing go into the mouth anymore. May save him from having this problem. Searching the client airway. Look at it. Gargling voice quality afterward. You may have aspirated. He had stroke. Will you put the thing in suction his airway? Well, he may not like it. The best thing and the safest thing to do in the NCLEX when you see something that two answers that are close to each other, one is preventing further and the other one is treating it. I'd rather make the patient NPO. Don't drink anymore. I can check if I can suction you. We let a speech therapy do what? Test you and make sure your swallowing mechanism is okay. So this patient need to be placed NPO. If you choose number 4, don't worry. We're thinking. This is how we practice questions. This is how you think about it in physiological adaptation way. I know I got a patient may have choked, but the voice, you can't do anything about it anymore in terms of what is happening to the patient. You want to prevent further harm. So if you focus on suctioning the client, that means the client can drink again, right? Therefore, we should prevent the client from drinking. Safety first. Which action should the nurse take first? 6 hours after surgery. What? Abdominal surgery. Think about it. That's a buzzword. Surgery in your abdomen, in the NCLEX, when you see it, I want you to circle it. They tell you something. Patient has surgery in the abdomen, worry about one thing and one thing only. Blood pressure is 80. That's the thing I want you to worry about. There's something causing the blood pressure to go down. Tachycardia, right? The skin is cold and clammy. Those are all buzzwords. What do you call this problem? Which action will you take? Check the surgical dressing and drain, administer prescribed pain medication, increase IV fluid rate, notify the provider. What do you think? We have a problem. 6 hours ago, abdominal surgery, mostly bleeding, and I'm having hypotension, tachycardia, cold and clammy. This is consistent with what? Shock. This patient has hypovolemic shock. Based on that, which answer choice will you pick? I'll give you the content, analyze the question. I know what I'm looking for. I'm waiting for the buzzword. And what am I going to use to answer the question? Not all this, only shock. If I'm in shock, I check the surgical dressing in the drain. I give the patient pain medication. I increase IV fluid and notify the air care provider. Before you call the doctor, he's going to ask you, how does the dressing look? Is the drain, there's blood in it? Prescribe medication. Patient is not complaining about pain. IV fluid rate, that means you are assuming this is okay. The same thing, the previous question, the same thing. When you suction them, you are assuming it's okay to drink. This is the same thing. Increasing fluid rate means assuming this condition is not deteriorating. You are not thinking like a physical adaptation issue. Patient body is changing and is adapting physiologically. That is the definition of physiological adaptation. We need to curtail that problem and stop it from going. Check the dressing and the drain. If you see blood, call the doctor, say, yep, we have a problem. It's bleeding. Patient is hypovolemic. Something is not right. Therefore, that's your right answer. Which type of shock should the nurse expect? The same thing I want you to think about. I've already given you the answer, but this is in a different way. A nurse is caring for a client who was involved in a motor vehicle accident and sustained femur fracture with multiple soft tissue injury. The heart rate is 130, blood pressure is 88, skin is cold and clammy, urine output is 15 ml per hour. You may see this kind of long question. It's designed to test your critical thinking and see if you get frustrated. Don't worry, go for the buzzword, and I will show you how to go for the buzzword. He said what? Suspect about what? Shock. And no patient is in shock. Therefore, which shock will give you low what? Urine output, skin get cold and clammy, this isn't this, tachycardia and that. But the key is involving what? Motor vehicle collision and has femur fracture. There's no evidence of sepsis. You don't see infection there. There's no evidence of neurological shock. Why? What do you expect in neuroshock? If you need help with content mastering with shock, check Adapt and Class. I have a video that talk about all the stages of shock in the easy and simplicity. Our channel is a home of content simplicity. Shock, there's different kind. Neurogenic shock, you're going to be what? Hypotensive and bradycardia. Patient what? Is hypotensive and tachycardia is not. Cardiogenic shock can happen in this situation. But if it's so, I'm not going to tell you it's cold and clammy. Mostly cold and clammy skin is consistent with what? Hypovolemic shock. Therefore, this patient is in hypovolemic shock, and the accident is consistent with that. If it's cardiogenic shock, I'll tell you more about their heart function. A nurse is caring for a client with the history of what? Chronic steroid therapy who abruptly discontinued their medication 2 days ago. Which findings should the nurse expect? Endocrine is also, like I said, endocrine play a major role of what? Physiological adaptation, because most of the conditions is under physiological adaptation. When you do something, your body changes and you have to adapt to it, hypothyroid and all those conditions. It's a key word there. Patient is on steroid, and then they stop taking it. What do you expect? Stop the video, and think about the answer choice. Consider each choices. They are combination. If one side is wrong, both of them are wrong. Write down your concept. Take your time. NCLEX is doable. HESI is doable. What? ATL is doable. ATI is doable. Nursing school exams is doable. If you take your time and break down the question. Now, it's on steroid. I know what steroid does. Your sodium goes up. Potassium goes down. Your blood pressure goes up. And you gain weight. If you don't have steroid, just flip the numbers. Your sugar is not going to go up. Your blood pressure is not going to go up. Your sodium, there's not much steroid, it go down. The potassium will go up. Fluid retention, you're going to lose fluid. Weight gain, you lose weight. If you're losing weight, your energy is not going to go up. Your blood pressure is not going to go up. This is adrenal insufficiency. And this is how the NCLEX or nursing school exams will ask you. So be ready for that. Last question. What is your score so far? I would like to know how you trying to master them. This is physiological adaptation for NCLEX. It's the same thing you can see in the ATI exams or NC or ATI. But think about it. It does not matter the type of exams. It's based on whether you understand the concept. And this is one of them. Which medication should the nurse anticipate? A client with acute kidney injury report, muscle weakness, buzzword, EKG, PT wave, connect the dot. If you learn how to do that, case study will become easy. EKG changes, muscle weakness, and the condition, hyperkalemia, is what is going to cause this problem in the kidney patient. Therefore, what would you do? Give them furosemide? It will lower the potassium, yes. Calcium gluconate, potassium chloride, magnesium sulfate. What do you think? Fluid and electrolyte. What would be your answer? Let's put in the score, a challenge for number 10, and see who got it right in the comment section. What do you think? I would like to know. But the key concept here is EKG changes. Patient has EKG changes. So if you have hyperkalemia and you have EKG changes, stabilize the heart. Furosemide will lower the potassium, but it takes some time. The heart is being destroyed by the potassium already. It's telling the heart that I'm in trouble. Your heart is telling you that. Calcium gluconate will stabilize your heart. Potassium chloride. Potassium is already high. Magnesium would depress the nervous system, but it does not have too much cardiac effect at this time. Therefore, number 2 is your right answer. 10 questions, physiological adaptation in a very short time. You learn the concept associated with each emergency situation that they may ask you. I want you to sit down, watch this video I made, Physiological Adaptation, How to Study. I will link you to that. It's a supplement. This is designed to supplement this video so that you can see where to pay attention and how the questions will be asked. You know them already. You just have to know how to approach them and how to think about them. If this video helped you pass your exams, if the video helped you prepare for your exams, put down a comment, subscribe to Adapt NCLEX, and like this video. If you have a question, put it in the comment too. Take care of yourself and be good. Bye-bye.